Continental flies the newest jet fleet.
Sweet ride.
Continental Airlines. Work hard. Fly right.
Now Washington is getting serious about Medicare fraud. D.C. hoping to reduce the estimated $55 billion in improper payments made each year in Medicare and Medicaid, programs which will be greatly expanded with the new health care law. Shouldn't that have been addressed before making them even bigger to Republican congressmen and physicians? So I got to be careful here. This guy really does know what he's talking about. Phil Rowe of Tennessee. Congressman, doctor, very good to have you.
Oh, Neil, thanks for having me here.
Usually that's the idea. You fix what you've got before you make it bigger. They did just the opposite. What's the deal?
You know, I think part of the problem was, Neil, when I look at a problem as a doctor, as I evaluate...
What kind of a doctor were you?
OBGYN.
Oh, okay. And
delivered babies. And when I looked at a problem, I said, look, what's the problem and how do you fix it? Well, the problem in American healthcare was it was costing too much. And secondly, we had some of our citizens, too many of our citizens, that didn't have health insurance coverage. Anyone can go to an emergency room. And we've experienced this in Tennessee where we massively expanded TennCare, and our costs just went through the ceiling, and it increased fraud and abuse and prescription drug overusage and on and on and on. And you nailed it right on the head. This bill didn't do anything to control costs, and as you expand the coverage like that, and when the government's already proven they can't oversee the program, you're just expanding the problem.
All right, so it is what it is, and short of, you know, obviously you guys getting majorities in either one or both houses, and later on it would take a Republican president, maybe a veto-proof majority that you could secure in both houses. But it's very unlikely to repeal this thing outright. So what's the strategy?
I think part of what you've got to do is go to find out what you have a bipartisan agreement on. Let me give you a couple of examples. This 1099 form. Most people are just now, and I have to tell you, I read the bill and I missed it on the first run. And what that is for our viewers is that for every business-to-business transaction, you've talked about it here many times,
right.
It's over $600. Think about how many millions of those. That's another unfunded mandate for our businesses to have to fool with. And that's both sides of the someone who sends you something and you that receive it, both have to send this in. A second part, and I think I've already signed on to co-sponsor legislation to get rid of that. It's a disaster for
How likely is that? And anything else you're coming up? But I mean, the understanding I had, besides just the battle in the courts, is that this train has left the station.
It's left, but we may uncouple a couple of cars as it leaves. And I think this is one that business is going to demand it. I think both Democrats and Republicans realize. And Neil, you need to ask yourself, in the most important piece of social legislation in 50-something years, how many people read this bill? And I can tell you it's amazing how few people read it front to back. Another part of this bill that needs to be relooked at, and I'm a sponsor of this legislation, is the IPAB. Independent Patient Advisory Panel or Board. And what that is a panel that Medicare has. Used to be an advisory board to Medicare. Now we've given up our oversight. The House bill didn't do it, but the Senate bill did, and now it determines how Medicare dollars will be spent once it's fully implemented. Can you say rationing care?
Well, and you were talking about that when nobody was. We'll watch it very closely, Congressman. Thank you very much.
Thanks, Neil.
Thanks
for having me on.
When GM stock goes overseas and taxpayers are thrown under the bus, stick around.
Tomorrow on Imus in the Morning.